Hi everyone, I'm so excited to talk to you today all about moxibustion, which for those of you know me, moxibustion is one of my favorite subjects, of course, alongside everything to do with Japanese acupuncture and moxibustion, of course. This is ShinKyu University. If you are coming here for the first time, welcome. I'm so glad to have you here. I do these lives every single Wednesday. They're a little bit later now than they were in the summer, simply because I have a later schedule here at my clinic and I do them at the end of my day. But I do this every single Wednesday, somewhere between 4 and 7 p.m. Mountain Standard. Again, it's just at the end of my day. If you like this content, please do like, subscribe, and hit the little bell to be notified of future videos and live videos coming out on this channel all about Japanese acupuncture, moxibustion, medicine theory, and so much more. So very excited to be learning with you today. So just to get started, and even if you're watching the replay of this live video, I highly suggest that if you have any questions, do put them in the comments below. I really do love talking with my students across the world and practitioners across the world about this medicine. So I would really love to have that communication with you. And then also, if you're interested in joining a more in-depth one-on-one conversation and mentorship program about Japanese medicine, do hit the link in the description box below to set up an interview to see if you are a right fit for ShinKyu University and if ShinKyu University's content is a right fit for your practice. All right, so without further ado, we're going to go ahead and get right into today's topic. We're going to be talking all about direct moxa and indirect moxa. So I have some moxibustion here right in front of me. And so I'm going to move this back so you guys can see what I am seeing, and then just talk a little bit about it. I'll try to be in the camera as these things are in the camera, though it's kind of hard as it's a lower platform. So there are, of course, several different kinds of moxibustion, right? So we, of course, have our direct moxa. Direct moxa is very easy to understand. It's direct half grain or full grain moxa using a very high quality moxa. This right here is made from Kobayashi moxa. It's a Miyabi brand. It's their specific kind of moxa. I really, really like the Miyabi brand of moxa. Again, it's from Kobayashi. I forgot their name, rest of the name of the company. So I really like that direct moxa. Then we have some other direct moxas. One of them in particular is ShinKyu. Now, ShinKyu in the actual Japanese language is not called a direct moxa. I'm going to term it here as direct moxa simply because it's being placed directly on the skin. And I think that's a little bit easier to understand. However, direct moxa usually is only terms for half grain or full grain moxa, which we're going to talk about in a minute. But I'm going to, again, put ShinKyu in that category here. Why don't we get a little stand for this? I'll just use my tissue box. There we are. So we have direct moxa. We have our ShinKyu here. And then on the other side of the platform here, we have pole moxa. We have some Nepalese moxa. I've done a video on both how to utilize and where to buy Nepalese moxa, and then ShinKyu as well, if you're interested in those and aren't familiar with those two kinds of moxa. And then in the middle, of course, we have needle top moxa, of which I don't have a good example of right in front of me. But needle top moxa is, again, an indirect moxa, technically, because it is not touching the skin. So we're going to put it in the indirect moxa category. So those are our types of moxa. It's pretty easy to understand. Outside of this, there's also things like pole moxa, not pole moxa, the boxed moxa, which of course is indirect. And I wonder if there's another kind that I'm forgetting off the top of my head. I also use takegyu a lot, which is often in the West we know it as ontake. Ontake is another indirect version of moxa, which I also quite love. So we'll talk about when to use those, when those are commonly used and when the others are commonly used now. So let's get into the easy stuff. So of course, pole moxa is an indirect moxa. I would say this is the most common type of moxa that is taught in TCM schools. You probably have seen it. You've probably learned how to use it. Pole moxa is very easy, right? You just use it on the surface of the skin. Now, I don't actually use pole moxa frequently in my treatment. I would say the one time that I would start utilizing pole moxa is actually when I'm dealing with someone who has like a shingles outbreak. And so one of the things that I learned about pole moxa while I was an apprentice over in Japan for so long is that it's really stinky, it's really smelly, but there are very specific instances where pole moxa is actually preferred over any other because it's really hard to touch the skin. In those cases, it would definitely be like when someone has Bell's palsy on their face. And I have had a practitioner teach me how to do direct moxa on Bell's palsy directly on the face. However, I would say for most people, it's kind of dangerous for you to do that unless you have a lot of control over your moxa. So I would say actually using pole moxa in cases like with shingles would probably be your best bet. I don't think I would really use pole moxa outside of the shingles outbreak in any other instance unless there's something that um, like shingles is quite painful to touch. And so how you do that is over the shingles outbreak. You actually do the pole moxa over the shingles outbreak, so you don't have to touch the skin, but that radiated heat still is able to help the shingles outbreak, and it really does help to bring down inflammation. It helps to bring down the pain of the shingles outbreak, along with, of course, treating why the shingles outbreak is happening. So you don't ever want to discount that. But that's like a more localized treatment. I never give these suckers to my patients. I give stick-on moxa, which is another kind of indirect moxa, actually, because it's not directly touching the skin. And that's also including moms for like induction or breech or something. I definitely use stick-on over pole. I just don't think pole is as effective, and it just gives off too much smoke. So the other time that I use this is when I use it on top of salt on, for example, the belly button. So that is a really good usage of pole moxa that is not quite as stinky. And if you're interested in doing that, you can definitely head over to my channel. One of my videos is salt pole moxa on salt. So you can check that video out to learn how to do that. So Nepalese moxa is similar to pole moxa and also to ontaki or takegyu. In that it's not directly touching the skin. So Nepalese moxa, you actually have a towel or usually something a little thicker than a sheet that you have this lit, you touch the towel and then use a shiatsu amma massage in order to press the heat into the deeper layers of the body. It's a beautiful version of moxa. There are definitely some downsides to this moxa. One is I actually buy the Nepalese moxa from Hatha Sensei's organization in Nepal rather than make it myself. You could definitely make one of these yourselves. It's not difficult. It's just a thicker version of pole moxa. I buy it from them because I like to support that organization that's helping, lower income women in Nepal create income for themselves. However, because of that, it is quite expensive. So again, you could always make it on your own. It's not difficult to use. I would say it's about a little over maybe like an inch and a quarter wide in diameter. So it's not too hard to make, I would assume. Saying that though, it does give off a lot of smoke. Where I like to use this over, for example, the pole moxa or even my direct moxa or ShinKyu is this is able to get a lot of moxa heat and almost direct contact with the skin to a very large area, and it's able to penetrate very deep into the body or on shallow layers of the body, depending on how much you utilize your shiatsu massage to press that heat down into the body. So it's just a really great form of moxa to get a wide area and really to penetrate deeply. It's I would say hands down the best kind of massage that you could ever get is with utilizing this Nepalese moxa with the massage, because it's like getting into a hot spring and getting a massage at the exact same time. I don't know how else to explain it. It feels amazing. You can do it everywhere from the eyes all the way down to the toes. You do have to be really careful with the sucker about over tonifying, overwarming the body though. So I would not be utilizing this with someone with excess heat in the body because this will actually overheat them rather than, it doesn't work as well with dispersion, I find, because it really does heat those internal layers of the body. But you can do it. Anything can be both tonifying, dispersing. I tend to use it more for ultra tonifying kind of methods. Now, our direct moxa and our ShinKyu, this gets a little bit more tricky, and also needle top moxa, which we don't have here. So when I use and differentiate those, and when I have learned to differentiate the usage of those tools. So needle top moxa, I have seen used everywhere from bladder 1 all the way down to kidney 1. So in a very wide swath of area, probably not Ren 1. That wouldn't be very pleasant. But like bladder 1 feels amazing for people who have, with needle top moxa, with people who have really tired eyes, over stress on their eyes, people who have problems seeing at night, night vision issues, people who have glaucoma, um, variety of issues, people who are just tired of staring at a screen too, Um, also people who are having, depending on the headache, and the presentation of that headache, certain types of headaches that can be extremely effective for. Now, kidney one is a lot more delicate of a place to be putting needle top moxa. I think you have to have a lot of skill with your needling. Of course, bladder one as well to be able to needle there. This is definitely not an allowed point in TCM theory to do needle top, right? So you make sure that if you're doing needle one, bladder one, excuse me, or kidney one with needle top moxa, that you have a mentor there to help insert that needle. But where I would really use it differently, no matter where it is on the body, and I would say probably do for, bladder 23 or Ren 4 or something like that would probably be more common, stomach 36, spleen 6, stuff like that, would really be to tonify. So again, moxa generally is a tonifying treatment, but needle top moxa, a little bit like our Nepalese moxa, is really uniquely capable to pinpoint a location inside the body and then really locally warm not only the needle tip, but the surrounding areas. So it's a very specific way of warming. Whereas with Nepalese moxa, it's a quite broad spectrum. It's hard to be super specific to a needle point diameter with Nepalese moxa, or for that matter, with your pole moxa. But as opposed to your direct, right, half grain or full grain moxa, it's not going to be just a moment of heat, right? Because that's what our direct and indirect moxa is. It's just a moment of heat, just a moment of heat. This is a pinpoint, very direct, very specific heat that lasts for a good while, right? It depending on the size of the ball that you put on the needle top. So in that way, I don't use it a ton in clinic because it takes a little bit longer than other types of moxa does, and it has a higher rate of incident to it. You can burn someone easier with needle top moxa, but there are very specific instances when people are having a lot of UTIs, when there's incontinence in the middle of the night, or frequent peeing, frequent urination, especially in older gentlemen, when older gentlemen have high PSA levels. I've found needle top moxa somewhere in and around the stomach 30 area. So obviously not directly stomach 30, right? But that whole area, if you can think of it as a zone on the inguinal area, usually a little bit closer towards the stomach, upper stomach line, right? So maybe like stomach 28, 29, depending on where you're at, to be able to get a really pinpoint location deep into that lower pelvic region, I found to be very, very helpful. Of course, bladder 23, Pgin, Pgin, oh gosh, my Chinese pronunciation. It's an extra point. These are all places that I found needle top moxa to be absolutely spectacular. Now, there are times when I don't want to use my needle top moxa, nor my Nepalese moxa, nor my pole moxa, and that's in areas that I want to specifically disperse. Now, when I want to disperse with moxa, and yes, you can disperse with moxa, I'm going to either use my direct moxa or I'm going to be using my ShinKyu. For those of you who are unfamiliar, ShinKyu is a larger cone. I would say it's about the size. Let's show you a little bit closer. It's not quite the size of the tip of my index finger. I use one of those two forms. Now, when I differentiate for dispersion in particular for my direct meaning half grain, full grain, or my ShinKyu, is how pinpoint I want it to be again. So with direct moxa, what we typically term direct moxa, meaning half grain, full grain, it's a very pinpoint location of whether you tonify or if you disperse, right? Very specific location. Now, if you want a wider area, something more akin to your Nepalese moxa, but you want to disperse that area, then you definitely want to be using your ShinKyu, because your ShinKyu is going to be really adept at getting a larger area. Think of any type of bruise or contusion, really tight shoulders along the taiyang, that's a slightly larger area. Any type of heat or inflammation in the joints, oftentimes unless you can really feel into the joints and palpate specifically for a point. Sometimes Chinetsu can be a better option to give you a little bit more leeway and not being as specific with your moxa, especially when you're in the very beginning stages of creating your direct half grain, full grain practice. So that's where I would be utilizing Chinetsu. Now, of course, Chinetsu can be a tonifying treatment. Very rarely do I use it that way, but if you wanted to use your Chinetsu, of course, on top of garlic, ginger, salt, aconite, things like this, then you can kind of be a little bit different. And when you use your Chinetsu in that kind of fashion, it's going to turn a little bit more into a little bit more towards the Nepalese moxa usage. So when we use it underneath those, on top of those substances, not only is it going to be a broad spectrum area, it's not going to be as pinpoint and finite as even just the Chinetsu on its own, but you're also then compounding those chemical factors of course, the ginger, garlic, and etc., that are going to then be seeping into the skin. So yes, it can be both dispersing if you use garlic underneath it, all the way to very tonifying with salt if you use garlic underneath the Chinetsu. But in general, it tends to be a more dispersive, slightly larger area than your half grain, full grain. Now, getting down to the most finite, of course, is our half grain, full grain moxa. Now, for that, you want to be very specific about how you're doing this. I like to tell my students that half grain and full grain moxa cones, and saying that most people only do half grain for the most part, you have to be as specific as your needle tip is specific. So, and your needle's tip should be as specific as the width of your needle tip. So the point should be the width and specifically to the point of that needle. And that's how you're going to have to be with your direct half grain, full grain practice. You, of course, can do this as a dispersive or a tonifying method. If you're interested in learning how to create this, I have a few videos on that. Of course, excuse the quality of those videos because I'm not a videographer, but you can definitely check those out to be more specific. I would say of all the different types of moxa that we have here, including needle top, the one that I definitely use the utmost every single day in my practice is half grain moxa or full grain moxa. I use it 100% of the time to disperse and to tonify. And the only times I wouldn't use this to be specific about dispersing and tonifying is when I'm using it on a child. And with children, I tend to use the stick-on rather than using this direct moxa specifically, just because the children tend to be a lot more sensitive to the heat, and I never would want to hurt a child that came into my practice. Oh, do you use the same case? Oh, very cool. Cool. Yeah, I actually got this from a practitioner in Japan. So this is just like, it's a pill case from the 100 yen store. So it looks like you're from Japan. So very cool. Hajimemashite. Yoroshiku onegaishimasu. Yeah, so I highly suggest when you do your direct, indirect moxa that you're thinking about the differences between, oh, you got yours from Muji? Yeah, 100 yen, so much cheaper. So much cheaper. You should go to the 100 yen store. Just get the little pill box and then you break them apart. Like you can see where they broke this one apart. Anyway, for those of you who are in the States or anywhere else who are watching and are curious about these little guys, by the way, totally different subject. You can just get any pill case and then you just want to clip it apart. And then I have mine in like a pen case. And then I have like a little chopstick holder for my insides. Anyway, I digress. So when you're using your direct moxa, and trying to differentiate in your practice between, okay, should I use pole moxa? Should I use Nepalese moxa? Should I use needle top, Chinetsu, direct or indirect, direct half grain, full grain, okyu, when you're trying to differentiate between these objects, you want to think about how specific do I want to be with my client, right? Do I want to be very pinpoint, or do I really want to access a broader area initially or finitely initially, right? And then also, how much control do I have over those objects, I think is another subject that you really need to be honest with yourself about. If you're not very confident with your, for example, half grain practice, then you, of course, can use some cheats. Like you can control the airflow with your fingertips. You can use some ShinKyu purple cloud ointment underneath it, right? So you can do some things so you can get away with using your half grain practice. But if you're still not comfortable with that, going to something like needle top or your pole moxa gives you a nice go-between. However, as I said before, your pole moxa and your needle top moxa is not not a dispersing practice, right? And so dispersing things like inflammation in the joints. For example, I had a young girl came in today who's 7, 8, and she's had inflammation in all of her joints for most of her life. She has what is an early presentation of RA essentially. And so for her, if I were to use like pole moxa, it might be over tonifying for her. Ideally, if she was adult, for that patient, I would be using direct moxa on where she has pinpoint location of her pain in her knees, back, and neck, where she tends to get it, and sometimes in her hands. Because she's a child, I use my stick-on moxa instead. And then when I want it to be a bit more dispersing, when she says it's too warm and it's a little pinchy, I leave it on for a half second longer than I normally would to try to disperse some of that local inflammation. So yeah, so that's all about, a very quick summarization, of course, of the differences in the types of direct and indirect moxas that you can definitely use in your treatments, and when to start really thinking about which choices you should make, when you should use this type of moxa and when you should use that type of moxa. And just a caveat at the end, like depending on the style that you end up practicing, whether that's Japanese meridian therapy or Yashinomichi like myself, or any of the hundreds of different styles of Japanese medicine, how they utilize their moxa, right? Do they use a bamboo tube over their direct moxa? Do they only do needle top moxa? That's going to change depending on the style. I still think it's really important for you, however, if you're listening this from the West, to get a really good foundation to both your moxa and your acupuncture practice. And this is, of course, something that I teach in ShinKyu University. One of the things, like today, we had our acupuncture study group. And so I was trying to overview people how to do what's called Shinkan Teiho, which is you take the shaft of the needle and being able to change directions while you're in the body, or trying to do your bloodletting, shiraku, a little bit gentler, a little bit softer without pain, how to hold your tools correctly, of course, and then when to start thinking about, okay, now your technique is down pat. Let's start talking about when you actually apply it. So all of those things are a little bit more advanced that we do when we're in those one-on-one sessions in ShinKyu and community sessions. So if you're interested in doing that, please do check in the description box below. There's a link to set up an interview for ShinKyu University. I would love to learn with you. And if you have any questions, comments about some moxa types maybe that I didn't cover, or some questions that you have about using direct or indirect, or when you've come into situations, I would love to hear about that. Again, please do put it in the comments. I would really love to have that conversation with you and learn from you and with you. That's all for today for our direct and indirect moxa. I really do hope that this helped you. Don't forget that if you like this video, to hit that little like button, subscribe, and hit the bell to be notified of all future videos coming out about Japanese medicine here on ShinKyu University. All right, it was so nice learning with you all, and until I see you next time, happy practicing.